Hi, I'm Jim Rush again, and putting in a new video up. The last time we did a video on the emergency management program for your hospital, and this time we'll talk about the emergency operation plan, which is the beef in your plan that explains how things are done, why things are done the way they are, that type of thing. I'm doing these videos basically as an appreciation for those who have been so good to me over the years and given me so many wonderful opportunities to grow and learn, and I wanted to pay that forward to the next generation of healthcare administrators, emergency managers, and supply chain managers. So once again, the emergency operations plan is a team effort, and the boss, the CEO, will have to be not just buying in, but also basically the advocate for the program. I recommend this starts with the chief executive officer putting forth a letter that will go in the plan, and it will also go to each new employee stating the hospital's intent to stay in business for the community throughout disasters and recover from them, and also provide after the letter, I would suppose, a handbook that gives a 20,000-foot view of how the hospital will maintain services, how conserve resources, what services may be curtailed, and how the hospital will communicate with the community, typically through the hospital website, with patients, loved ones, staff, and jurisdiction emergency operations center. And as a last resort, explain how a staged evacuation or a semi-evacuation or a total evacuation will occur. I've always disliked that because it almost gives you an expectation that when there's a large-scale disaster, that means the hospital is going to have to evacuate. And when you do evacuate a hospital, you can talk to those who have, and they will tell you, you don't just come back into the hospital a week later or a month later. There's a host of things that have to happen to get the hospital prepared to receive patients and staff again. The hospital emergency manager is basically going to be the architect of the emergency management program, the emergency operations plan, and all the annexes. The emergency manager will serve as the hospital's face to the jurisdictions emergency manager and external organizations, including organizations like the Red Cross and other NGOs, non-governmental organizations. And the emergency manager also helps prepare press releases for the public affairs officer or the CEO. The emergency manager will coordinate before the disaster with civic service organizations such as the Lions Club and the Rotary Club. And I'm suggesting that every time you do a community exercise, you conduct a blood drive with the American Red Cross or a blood management company in your area. You hear every year, in the summer especially, that we're down to 2 days of supply in blood. There doesn't need to be that when we have hospitals all over the country conducting exercises, community exercises. Why not have a blood drive? Because it basically provides blood that can be used by the hospitals in that area, but also it gives the citizenry an idea on where they got to go if the real thing happens and the call goes out for blood. So it's a real good idea, and I just don't know why its time didn't come a long time ago. But I recommend that you conduct a blood drive at the same time you're doing your community exercise. And so anyway, that's the introduction to the emergency operations plan. And next time we'll talk about the annexes, which basically is the how-to. One other thing, as the in each of the areas where the CEO speaks in general to the various things, how we're going to take care of patients, and then say C annex, patient services or patient care annex. They're talking about conserving resources or gaining resources during a disaster. Then after that, I would say C, the annex, medical material services, that type of thing. So if a accreditation agency comes in, as they read the CEO's introduction and the handbook, they can see exactly where to go for more information on how, when, where, and why those things will be done. So again, thanks a lot for tuning in. If you want to have access to all of the video presentations, just push subscribe at the bottom here, and then you'll have access to everything I'm putting up. Thanks a lot, and take care.